So for this first post for DB1 and 715, I talk about some of the challenges of borderline personalities, and I have worked with borderline personalities, and oftentimes you'll find that they make excuses, they exaggerate, they lie, there's subterfuge, they attack others, their emotions are labile, and it's a challenge. With mentalization, I think that the therapist can bring forth some methods to bring them to facing themselves, facing reality, and also in transference focused approach is where you can expect that the person with the borderline personality disorder might look at that therapist as a figure in his or her life and go from there. And that's a challenge, but the prepared therapist can do it, as this one did. And to think about a more high-functioning client, we see that in one of the videos, the first video, where the young lady has some problems, but they can be dealt with. She's reasonable. If she's called on her behavior or on her thoughts, she can realize that there are maybe some of them are not so reasonable. So the therapist can then work with her, and there's even use some humor, and the patient herself has used some humor. This client probably does not have a borderline personality disorder, probably a fairly well-balanced client with just some issues. I'm wondering, though, if how often, especially with borderline personalities, I often wonder if they're kind of playing you. They're playing the therapist, and and not being totally truthful, and not coming clean. And maybe the therapist doesn't always know it. It takes a wise therapist to really be able to figure this out. So that's one of the challenges. So